what should you eat properly if you have diabetes? Or what foods are forbidden for people with diabetes? How can you keep your blood sugar at a normal level? And what blood sugar level is actually considered normal? Today, we're going to talk about diabetes. I will tell you everything you need to do, everything that must be done to maintain normal blood sugar levels, and how to cure, yes, cure. You heard that, right, cure diabetes. This is an extremely interesting topic. Let's get started and talk about it. So in order to talk about diabetes, we first need to understand how carbohydrate metabolism works in our body. Carbohydrates are essentially glucose, as well as some others, maltose, mannose, fructose, and other carbohydrates that are absorbed in our small intestine. The carbohydrates we eat are initially broken down by the enzyme amylase from the pancreas into simple components. The complex ones are decomposed into the simplest components, and these simplest components are absorbed into the bloodstream through the villi in the small intestine. Later, as they circulate in the blood, they reach every organ, every part of the body, every cell in our organism. And then glucose enters the cells of our body where it goes into the mitochondria. In the mitochondria, it is broken down, producing a large number of charged batteries, as I like to call them, which are ATP molecules. An ATP molecule is an energy resource that is produced in the mitochondria of our cells, and all vital activity is carried out thanks to the energy from these ATP molecules. So these ATP molecules are formed and charged like little batteries during the breakdown of glucose. That is, we need glucose so that all the cells in our body can function in essence, the activity of every cell in our body. The brain, the digestive system, the cardiovascular system, the muscles, every single organ, all of them need glucose to live. This is the food, essentially, that the organs eat, so to speak. But there is one particular feature. Glucose circulates in our blood, and there is a specific hormone called insulin. And this hormone, insulin, is a special guide that takes the glucose molecule and carries it through the cell membrane into the cell. In other words, insulin is a hormone that transports glucose into the cells. If insulin is present, glucose moves from the blood into the cells. If there is no insulin or there isn't enough of it, two processes occur, one visible, the other invisible. The visible process is not dangerous, but the invisible one is very, very dangerous. The visible process, glucose that hasn't been transported into the cells remains in the blood, and we see an increase in blood glucose levels. But the invisible process, which is very dangerous, is that glucose does not reach the cells. The cells are starving, they are left without energy resources, they cannot perform their functions, and the body suffers greatly and becomes ill because of this. And this condition where blood glucose levels are elevated is what is called the disease known as diabetes mellitus. In other words, diabetes mellitus is an increase in blood sugar levels. And this happens as a result of a person having too little, not enough, or no insulin at all, which is the substance that transports glucose into the cells of our body. This, in essence, is what constitutes diabetes mellitus. The word diabetes itself means excessive urination. And because in diabetes mellitus, when there is too much sugar glucose in the blood, it starts to be excreted from the body as an excess metabolite in the bloodstream. It begins to be excreted by the kidneys, and then the urine becomes sweet sugar appears in the urine. And when sugar is already present in the urine, well, that's when it is called diabetes. Then the person often has to go to the bathroom, polyuria appears, and so the urine is sweet, and this is already a manifestation of a serious disease, diabetes mellitus. Let's go over a few more points together. Numbers. What is the normal blood glucose level? Are sugar with glucose or sugar, or are they the same thing? Well, we do a blood test for the content of sugar in the blood. But besides glucose, sugar also includes things like maltose, mannose, and other sugars like fructose. And a glucometer is a device that measures glucose in the blood. But these, friends, are actually different things. That is, before you get to glucose, there are several other sugars, and then you have blood sugar. Of course, nowadays devices measure glucose, but sometimes people misunderstand the normal ranges. If the normal blood sugar level is 6.6 and glucose is 5.5, then I just take the average value of sugar or glucose. It doesn't matter to me which one. To avoid confusing people, you just need to remember the number 6. The normal blood sugar level is 6. And only if the blood sugar is above 6, then we can start asking certain questions about whether a person is beginning to develop diabetes. By the way, if the blood sugar level rises from 6 to 10, and it still does not appear in the urine, an increase in blood sugar from 6 to 10 does not lead to the appearance of sugar in the urine. And this condition is called prediabetes. Prediabetes is when the blood sugar is 7, 8, or 9. But only when the blood sugar rises above 10 does it start to appear in the urine, and then this is already called diabetes mellitus, when sugar is already present in the urine. Now let's look at what causes the blood sugar level to rise. The first and most important reason is that a person may eat something. That is, a person eats something sweet, something made of flour, loads their body with carbohydrates, eats semolina porridge, and naturally in the digestive system, in the small intestine, a large amount of carbohydrates is absorbed into the blood, which leads to a transient, that is temporary, increase in blood sugar levels. And normally, after eating, blood sugar can rise to 7, 8, or 9, but not 10 and not above 10, because at that point, sugar appears in the urine, and the compensatory system of our body that regulates blood sugar levels is no longer functioning. Insulin will be released and the excess sugar will be driven into the cells so that the cells can feed. But an increase in blood sugar after eating is acceptable even up to 10. And this is not considered a pathology or a deviation from the norm. The next thing to keep in mind, after such a transient temporary increase, blood sugar should return to normal within 2 hours. If, however, 2 hours after eating, blood sugar still exceeds the specified norm of 6, then this condition is called impaired glucose tolerance. At this point, the normal functioning of our insulin systems is no longer sufficient to cope with the glucose load in a timely manner. That is precisely why all your measurements when you check your blood sugar or glucose must be done on an empty stomach, only on an empty stomach. When you test on an empty stomach, you get more accurate and reliable results than after eating. And you also need to keep in mind that another reason for elevated blood sugar is when there is a deficiency in the insulin systems. In other words, a person either completely or partially lacks enough insulin to handle the entire dose of glucose. There are 2 types of disorders that can occur. The first type of disorder is when the system breaks down, starting from the brain. The thing is, the functioning of the pancreas, specifically its endocrine part, the islets of Langerhans, which produce insulin, is regulated by the brain and by the pituitary gland. I can't tell you the name of this hormone right now. It hasn't yet been discovered by science, but there is a direct connection between the king of the entire endocrine system, the pituitary gland, and the functioning of other distant endocrine systems. For example, the pituitary thyrotropic hormone affects the thyroid gland, and the adrenocorticotropic hormone of the pituitary influences the adrenal glands. The follicle-stimulating and luteinizing hormones of the pituitary gland affect a woman's ovaries. In the same way, the pituitary gland also controls the functioning of the pancreas and islets of Langerhans. There is a direct connection there as well. However, the specific regulating hormone is still unknown to our science. It has not yet been discovered, but the direct connection is obvious and can be seen with the naked eye. The next thing to understand is that sometimes there are diseases in which the hormonal connection between the brain and the pancreas is disrupted. And in such cases, even when the islets of Langerhans are generally intact, the B cells, the ones that produce insulin, do not produce insulin at all. I'm telling you directly, there is none, absolutely none. Without insulin, blood glucose levels rise sharply. Without insulin, the cells suffer so severely that, well, the nerve cells can simply fail, and then the person can lose consciousness and fall into a hyperglycemic coma. And this condition is called type 1 diabetes mellitus. Its origin is right here. Its origin is in the head. The cause of this stress can be a variety of severe illnesses that a person has experienced, or simply an unexplained reason that disrupts the hormonal connection between the brain, the central nervous system, the endocrine system, the center of the endocrine system, and the pancreas. In type 1 diabetes, these connections suffer. It's like a hormonal disorder. Such people almost always use only insulin for treatment. They inject themselves with artificial insulin and then continue living on these injections for many, many, many years. However, the quality of this insulin will determine both the length and quality of life, as well as the speed at which complications develop, which inevitably accompany diabetes. Type 2 diabetes, on the other hand, is a completely different disease. These are people whose pancreas is diseased due to chronic pancreatitis, but most often because of excessive overeating, regular overeating, obesity, usually due to age, and usually because the pancreas is overloaded by abundant nutrition. In other words, insulin is produced there. The pancreas does produce insulin, just not in the amount needed for the quantity of food the person eats. That's their particular characteristic. And with type 2 diabetes, insulin is sort of present, but it's not enough for the person. In this case, blood glucose levels don't rise as sharply. This is usually considered a pre-diabetic state, 7, 8, 9, sometimes 10. And in this case, treatment doesn't involve insulin, but rather blood sugar lowering medications are used, glucophage, metformin, and others. They simply lower blood sugar levels due to these metabolic changes, but at the same time, they don't actually improve the condition of the pancreas itself. The pancreas remains in a state of chronic pancreatitis. And the condition is, well, milder than in type 1 diabetes. In diabetes, the target organs are affected first and foremost. The eyes are affected, a person goes blind, diabetic retinopathy. The heart is affected, the brain is affected. Blood supply worsens through the coronary arteries of the heart and the carotid arteries of the brain. The kidneys are affected. Diabetic nephropathy leads to their rapid destruction. And one of the most unpleasant aspects is that the legs suffer, as do other distant parts of the body. There, diabetic angiopathy develops, blood flow to the legs is impaired, and even trophic ulcers can occur that do not heal. This is known as diabetic foot. Or polyneuropathy. The nerves in the legs are affected because the nutrition there is disrupted, and a person loses sensation in their legs, polyneuropathy, in which it feels as if the person is walking on a soft carpet. Sensation in the legs is lost. And these complications occur with both type 1 and type 2 diabetes, but with type 1, they are often also accompanied by comas, that is, disturbances of consciousness, when there is either very little glucose, if it drops, for example, after injecting a large dose of insulin or very high glucose levels. In other words, hypoglycemic or hyperglycemic comas when consciousness is impaired due to sharp fluctuations in blood glucose levels. There's a little secret I'll share with you how to tell whether a person has type 1 or type 2 diabetes. Sometimes when I'm consulting people, I have to try to determine which type of diabetes they have, because the symptoms aren't always typical. There isn't a clear-cut picture like with type 1. And often the symptoms are like those of type 2 diabetes. In such cases, I give a helpful piece of advice: try not eating anything at all for 1 or 2 days. Just nothing at all. Only water. That's it. For a couple of days, and observe your blood sugar levels. With type 1 diabetes, even when a person doesn't eat anything, their blood glucose level will still rise without insulin. This happens because new glucose is produced at gluconeogenesis in our liver. It occurs. And that's why with type 1 diabetes, even if a person doesn't eat anything, their blood glucose level will skyrocket. The reason for this is a complete lack of insulin. With type 2 diabetes, the situation is different. With type 2 diabetes, if a person doesn't eat anything, glucose isn't artificially, that is externally supplied through the digestive systems, and simply by not eating, their blood glucose level will never rise. It will only increase directly as a result of eating. I would recommend that a person not eat for 2 days. If during these 2 days the glucose level rises, then type 1 diabetes is the issue, it's a problem in the head. If the glucose does not, in other words, does not increase, then it's type 2 diabetes, which means it needs to be managed through diet. And to address the problem of diabetes, I will recommend 2 of the most important solutions for properly establishing digestion in a person. Look, there's a secret, and I'm going to share it with you. Our pancreas as an organ, we are talking now about type 2 diabetes or pancreas, is most active from 9 to 11 in the morning. That is, at 9 in the morning, the energy flows into the pancreas. It begins to produce a large amount of enzymes that will digest what we ate an hour and a half earlier, that is at 7:30. And if by 7 or 7:30 a person still hasn't had breakfast, then the pancreas will use these enzymes to eat away at, break down, digest, and damage itself. As a result, the islets of Langerhans and the cells that produce insulin will be damaged. And simply put, there will be fewer of them mechanically. That is, because the person doesn't have a proper early breakfast, their pancreas gets damaged and stops producing enough insulin. In order for the pancreas to function well, it's necessary for a person to have the right kind of breakfast. Breakfast should be, first of all, the largest meal in terms of quantity throughout the day. Breakfast should be as fatty as possible, meaning it should be complete, filling, and nutritious. And most importantly, breakfast should be early before 7 in the morning. And I've noticed that all diabetics have the same characteristic. I'm talking about type 2 diabetes. Type 1 is a different situation. But all people with type 2 diabetes share the same trait: they have a late breakfast. Diabetics are people who have breakfast late. Conversely, people who have a proper, good, and early full breakfast do not experience spikes in blood sugar. I did something different. I tested this. I made a group of diabetics, specially selected people, have breakfast as early and as fully as possible, and then observed that all of them stopped experiencing increases in blood sugar without any glucose-lowering medications. That's why there are two components for all diabetics. The first is having the right breakfast as early as possible. The second component, well, here you need a product made from turmanium ceramic. In this case, it could be a turmanium bell matter projector, it doesn't matter which one. You need to heat the turmanium product to a temperature of 50-55 degrees, place it on the right hypochondrium, not on the left where the pancreas is, but on the right hypochondrium end, warm the abdomen for 20 to 30 minutes at 50-55 degrees each time after eating, but mainly after breakfast. Warming the abdomen after eating ensures a good release of enzymes, proper blood flow, correct functioning of all glands, and the restoration of damaged structures in the pancreas. Of course, it's impossible to warm the pancreas itself with infrared heat. It is located too deep. But even this kind of warming improves overall blood circulation in the abdomen. And with this warming, we improve the functioning of all the organs located in our abdomen. That's why there are two components for starting the proper functioning of the pancreas in diabetes, so that it produces insulin, the right kind of breakfast on that is as early, large, and filling as possible. Then after that, a small lunch, and in general, a light dinner. And the second is to warm the abdomen with the infrared heat of turmanium ceramics. You could use an ordinary rubber hot water bottle or something else for this, but friends, I promise you that you simply won't get any results. You need the right kind of heat. You need heat that penetrates deep inside. That's why in my practice I use the infrared heat of turmanium ceramics, but you can try something else if you want. Just know that you won't get results if you use anything different. That's the information I have for you today about diabetes.